And I see that we have the Bharat Foundation with Chandvi Bharat, who is the founder and director, and Justice Sarami, who is the director of technology, who will be speaking this evening about their project, Creation Nation Girls in Tech. Can everyone please make sure that they are muted as the presentations are beginning?
But not me. I'm not muted, correct?
Chandra, you're on.
So you can hear me. Okay, so this is kind of a new form. Do you want me to go through the presentation? Is that the best way to do it? Okay, so you're going to share my screen? I'll just hit share screen and that should happen. Yay. Okay, so is everybody seeing my screen? Yes? Yes, okay. So this is a pilot program. It's a first and it was extremely exciting. We called it Creation Nation Girls in Tech, Girls in Art and Tech, because what we're doing, we're now defining as at the intersection of art and technology. So should I read through the brief description? I don't know how familiar you people are with what we do. I'll read through it. And then if you have any questions, make some noise. Okay, so founded in 1997, the Bharat Foundation, that's us, is a 501c3 nonprofit based in Newark, serving under-resourced youth and communities in New Jersey, as I said, at the intersection of art and technology. Core services include providing public art, arts education, and maker technology programs that directly engage under-resourced youth and communities of color in New Jersey in the process of what we call cultural artistic creation. Our goal is transforming young lives and urban communities through hands-on tactile art making, promoting STEAM education, placing the arts and maker technology at the center of economic growth, social justice, and civic engagement. Core services include animodule making. We're in 2 schools right now in Hoboken making 8-foot aluminum animodules, animodule DIY maker kits, which will be available soon on Amazon. Messages through murals, a series of murals we've done throughout Newark, and makerspace programming and Creation Nation Girls in Art and Tech, which is where we are. So here's a summary of the project, and it's a very exciting project, and I'm going to have Justice, who's really in charge of this program, talk more about it, but I'll just give you the overview. So Creation Nation Girls in Tech is a STEAM, and for those of us who are less familiar with STEAM than we are with STEM, STEAM is STEM plus art. So science, technology, engineering, art, and math. So Creation Nation Girls in Tech is a STEAM, art, science, and entrepreneurship program that teaches technical and entrepreneurial skills to inner city youth. The program provides hands-on skills in computer-aided design, that's CAD, engineering, and theory to create 3-dimensional artworks on 3D printers, with training that inspires and strengthens career and entrepreneurial opportunities made possible by these new and emerging technologies. One thing we've come to understand, we are essentially an arts education organization, is that if we can't provide these young people with a pathway to a career and not just work, we started this whole maker concept here, because the software that these young women from 11 to 17 are using here will enable them to go on in STEM careers if they choose to do so. The program's designed to help young women build the self-esteem and empowerment needed to attain their full potential in a rapidly changing world by engaging them in 21st century art and science-based community serving projects. I don't have to go over all the statistics, but it's in terms of STEM high-paying jobs, women are 20-something%. And our goal is to get women ready for these high-paying, exciting careers. The after-school program provides young women ages 11 to 17 training 2 days a week with 3-hour sessions, providing a safe haven for at-risk youth, enhancing and supplementing education to skilled employment pathways in high-paying STEM fields. So everybody got that, kind of? I just put some information on our onboarding process. We were in half a dozen schools in person onboarding girls. All in all, we onboarded 10, 20 young women between 5th and 12th grade. And here is our assistant, Benji, with the principal of Arts High School at one of our onboarding events. This Girls in Art and Tech was on our website, and we used it in terms of onboarding and attracting young women into the program. So I'm going to let Justice talk a little bit here about what you're looking at. We had many photographs. We just put together 2 collages, not to go on and on forever, to give you an idea of what the program looked like and what the girls were doing. So here's one collage, and here's another. And Justice, you want to talk a little about what these girls are doing?
Sure. How you guys doing? Good afternoon, good evening. So I'm Justice, the creative director at the Barrett Foundation who created the program. What we did was several things. Be it that my background is in prototyping and engineering, I wanted to give the girls the ability to have a hands-on experience with 3D printing from a design perspective to also a build perspective and also a finished product. So what I did is I created 4 projects by which the girls' first assignment was I wanted them to immerse themselves in actually designing a functional piece of something in the house. We designed a kitchen table because you have multiple elements, you have tables, chairs, plates, the whole top ring. What that did is I was able to show them how to create joints, how structural things are put together to combine elements. I gave them the example of like IKEA. Everything that you see at IKEA is designed in CAD and it's CNC'd and it's made to be assembled. So you have to understand when you're designing something, how the assembly process is. Also with designing the piece of furniture, I was able to teach them how to use different tools, beveling, custom designing their own spoons and forks and some of the design essentials that's inside Tinkercad, and also them getting into the driver's seat of actually for the first time seeing how they are now making it versus just looking at it or reading some instructions. They were able to do it hands-on and retrofit their own furniture, get engaged with the tools, which you see them. And then once I got them into the fundamentals of that, then we graduated into a second project, which was something more familiar to the girls. I said, okay, we're going to do pretty much what you guys like, makeup and, perfumes and everything. So I need you to design me about 6 to 8 products that would be technically in your beauty bar, body spray, perfumes, lipstick, brushes, all your girl essentials, because I wanted them now to immerse themselves in something familiar and then get them engaged in what would be considered product design. So I actually put a spray bottle so that they could see the componentry of how it works. And I wanted them to fully immerse themselves into the design of a full functional prototype by which each girl did their own rendition of their own product design of about 6 to 8 products, that they also put their own custom branding. As you can see, Carolina put her name, she put stars. So she designed her perfume bottle. She designed a body spray bottle, nail polish. Some of the other pictures have the full picture of actually the full designs that all the girls did. And you can see they all use different colors. We started engaging using color palettes for them to pick colors and how the colors synchronize together. So they started looking at Pantone charts and started working in intertwining a color scheme for the design. Once we completed that, the ambition for that is I have someone that works for L'Oreal that I wanted them to just introduce them to come in and actually see them and show them some of the products that some of the things that were designed, just to give them inspiration of someone who works in the industry, potentially bring them some perfume or some free swag giveaway for them to meet someone, talk to somebody from L'Oreal, show them, look, girls at 12 to 13 years old can do product design. And who knows, maybe in their latter years, they may be engineering and designing and prototyping for the company. Then the third project, I got more into, I wanted them to make what was considered a humanoid. I wanted them to get into the body typing, the actual human infrastructure, heads, arms, joints, etc. And I was able to give them a design model so that they can see that. And each one of the students picked out something that represented, either reflected them, something they liked that had more of hands. So we started getting into more of depth of just making the human structure, which is how you see here. She created her own person. That's the little piece I gave them to show them, body position, joints, elbows, wrists, etc. And then each one of them designed their own character so that they can engage and immerse themselves into character design now. Because
Justice, 2 more minutes, please.
okay.
Thanks.
So then moving forward, we went into
I'm sorry. Okay.
2 minutes. So I'll brief. So the last thing that they did was automotive design, where they got to actually pick a car online, and then they actually modeled their own car that they selected. So those were 4. So they got mechanical, automotive, product design, humanoid, and then structural interfacing. And then the final, of course, would be building the 3D printer and printing
Oh,
it.
I know we're running out of time, but I just wanted to go over the brief anecdote that we mentioned, and that
Oh, yes.
was that Jacob Rosa, who was a father of one of the girls in the program, was so impressed, so overwhelmed with the project that he brought in his 2 other daughters who were in
Yes.
this picture, and has now joined our team, adding his 3D animation and environmental design skill set to our offerings. He and Justice are now creating several new programs for students, including animation and environmental design. So this was totally unexpected and totally
Yes.
wonderful. This slide is essentially a description of what Justice just read to you, going over the four items that the girls were to design. The final printing is scheduled for this month, going into February, and then we hope to reopen the project for the spring semester. Can we keep going, or we're over time, or what's going on?
You're muted.
Pam, you're on mute.
Thank you. I did want to read one comment by a trustee that was in the chat, asking if you have any partnerships with local colleges. She writes, Montclair State has an excellent product design program that gives many scholarships. So I don't know if you are thinking ahead to what the girls in this program can do as their next step, but one of our trustees wanted you to know about that program at Montclair.
That's very interesting. We do work and have a close relationship with NJIT's Institute of the NJII is a very extensively multi-million-dollar creative space. So yes, we are absolutely thinking in that direction.
Okay, thank you so much. There's some comments coming in the chat, so you can feel free to stay on and read that. But we're going to bring in our next presenters. Thank you so much, Chandri and Justice.
I'm just sorry we didn't have more time. It's really an exciting.
Everyone will be getting a copy of your slides, so they will be able to see a hard copy of what you just presented. Thank you so much.
All right. Thank you, guys.
Thank you.
Okay, Chandri, you can stop this screen share.
Okay. Is that better? Oh, here, I see. Done. There we go. So anyway, it's so nice to see all your faces. It really is.
Great, thank you so much. Okay, Rachel, do we have Sharsheret here?
I'm here. Am I
Yeah.
supposed to have, I was under the impression you were gonna have the slide deck loaded. Is that correct?
I can have it for you if you want it.
Great,
Okay.
great.
Are we off now? Do I go off?
You can go off now. Thank you,
Okay,
Chandri.
Thank you. Thank you so much.
Okay.
Thank you.
Okay, so let me present you. This is Sharsheret. Deborah Silverman, the COO, will be talking about customized breast cancer and ovarian cancer quality of life kits.
Should I dive in?
Deborah, go on. You just
Okay.
you want me to
Can
move
you,
slides?
can you put my slides back up, please? You're on me, okay. And if you wouldn't mind just putting it in the slideshow view, then I can take it from there. But otherwise I can't control the slides.
Hi, that will take me a minute. I didn't have it up in slideshow view because
Oh, okay.
you were showing yourself. So
Okay, I thought that was, okay, sorry for the confusion. Hi, everybody. Thank you so much for having me this evening. And of course, thank you so much for the grant that you've provided to Sharsheret. I'm excited to share a little bit more about Sharsheret with you this evening and to give you an interim report on what we've been doing. So the slide that you see here is our mission statement. As you know, Sharsheret is the Jewish breast cancer and ovarian cancer community. And we really do take pride in being the Jewish community for all women, men, and families who are affected by or at elevated risk of generating for themselves, for people who they love, breast cancer or ovarian cancer. Can you scroll down, please? Great. So essentially, we have two types of services that we provide, our main buckets of service. The first is our LINK program, which is a continuum of clinical services provided to women and men and families and young adults starting in high school and going through college age young adults. Who have questions about their family genetic makeup and who worry about their risk for developing breast cancer or ovarian cancer because of family history or because of environmental concerns. And we support them through a team of 14 social workers and a genetic counselor who work individually with each woman, providing customized, individualized, obviously confidential, often anonymous services at no cost. And the second main bucket of service we provide is education and outreach, where we provide the Jewish community at large in all forms where Jewish people gather, whether it's in formal settings, informal or experiential settings, again, starting in high schools and moving up. We provide information to promote healthy living, healthy lifestyles, and to make sure that people are empowered to understand their own genetic risks. And to learn how to dialogue with their own team of healthcare professionals to try to prevent a diagnosis of cancer or to mitigate what effects that cancer diagnosis could have on their lives. You can scroll down, please. In terms of who Sharsheret serves, we are serving women and families in New Jersey and across the country in all 50 states. We have on our records more than 30,000 women who we've spoken with and worked with extensively. These 30,000 women have been diagnosed with either breast or ovarian cancer or both. And this is since our founding in 2001. Though I know it's not related to the grant, we couldn't resist the opportunity to let you know that we have just launched, done a soft launch of our pilot program in Israel. And we're really excited to see the services that we provide being accessed by women and men in Israel now. Can you scroll down, please? We were asked to give you a summary of the project, which, as you know, allowed us funding to provide quality of life kits to women who've been diagnosed with cancer. So these 6 are the most commonly accessed. Each of them is highly customized so that if you are a single woman past menopause, you will not be getting information about what it's like to have cancer as a young woman who's just starting out and thinking about fertility. If you ask us for resources about for family focus because you're a caregiver, you won't receive anything that speaks about a personal diagnosis for you. Everything is handpicked and customized. So you can read, I won't read to you, but you can read the brief descriptions of these boxes. What you can't see here is the way that they're presented. And we take great pride in gifting women with each of these kits. So they each come in beautiful boxes with beautiful ribbons and handwritten notes from the social worker that are written for the individual woman receiving them. And we do this because we want from every interaction that we have with a woman for her to feel like a woman and not like, like a woman and not like a cancer patient. And we take great pride in that. So I'll just mention to you one of the boxes. I'll go through the busy box with you because it's one of the most common and popular that we have. The busy box is something that's provided to parents of young children. And so one is information that's directly for the parent, for the mom who's experiencing a cancer diagnosis. And those resources help her understand and teach her, train her how to talk with her children about her cancer diagnosis based on the age of her children. So we have resources about how to talk to a teenager. We have resources about how a child. And in addition, if there are younger children, we provide age-appropriate toys and games that are available to the child. And we encourage the mom to give them to the child when she's just not feeling like she's able to be herself. She's not got as much energy. She's at a doctor's appointment or she needs to rest. So that's an example of the type of kit that we provide. Another very common one that we give out is our Thriving Again survivorship care that has a lot of tailored information. It includes, for people who are going back to work, information about returning to the workplace. There's a financial wellness component to that kit as well. We provide different exercise equipment and a healthy cookbook to inspire, good nutrition, which can help support cancer treatment. There's a kosher cookbook, and there's also a cookbook that is not kosher, depending upon what the preference of the woman is. So that's a quick summary of some of the kits. And of course, I'm happy to take any questions when I'm done, but I want to cover the content first. So this is Karen. And Karen has allowed us to share her name with you. This is Karen Newman. She's from Freehold, New Jersey. And her story really started when she decided she wanted to have a breast reduction. She went to a plastic surgeon, she made the appointment, she went in for the surgery, and afterwards she was called, and much to her surprise, they found cancer when they removed some of the breast tissue. So she was told at the time that it was small, it was simple, it would be easy, and she scheduled a lumpectomy to remove the cancer from her breast. As of course is the policy, they sent the tumor to the lab, and unfortunately it came back that it was a malignant cancer. And so she ended up having to undergo chemo. Up until the point in time she started chemotherapy, she was very private about her diagnosis. She was completely shocked, had absolutely no family history, and so this caught her off guard. But once she knew she had to undergo chemo, and because she was so shocked, she decided she was going to be very public about her now extensive diagnosis, and she was going to be an advocate and a champion for undergoing mammograms as routinely scheduled by a doctor. So she shared her story widely. Fast forward a few weeks after she found out her diagnosis and began chemo, her husband was at an event in the community and ran into a childhood friend of his and told his friend that his wife, Karen, had been diagnosed with breast cancer. And as fate would have it, the person he was telling was the father of one of our social workers, who said, "Oh, my daughter works for Sharsheret. Do you know Sharsheret? You should really have Karen reach out to Sharsheret." He said, "Karen is so overwhelmed. I don't know. I'll tell her, but I don't know. She's just exhausted. She feels so lousy from the chemo. I don't know that she can handle it." So the father said, "Okay, well, maybe you want to reach out to Sharsheret then." Fast forward another week, Karen bumps into the daughter, who's the Sharsheret social worker. They realize they have a lot to talk about. And Karen says, "I didn't want to be a burden." I can't tell you how frequently we hear that. "I didn't want to be a burden. I don't need help. I have support. I have an amazing family." So our social worker said, "We have things that can support you. If it's okay with you, I'm going to give you a call tomorrow." So she did. And Karen began to receive the kits that we just sort of went through that applied to her personal circumstances. She ended up having a double mastectomy, and she received from us her Best Face Forward kit, which includes paraben-free makeup products and a self-guided sort of how to put on eyebrows, because very often women undergoing chemotherapy lose their eyebrows in addition to their hair. And she received a blanket and a robe to help with some of the temperature adjustments women undergo during chemo. Her family received a family focus kit that includes resources for caregivers. And then she received a mastectomy kit, which includes a pillow of support that is in a beautiful lace pillowcase that is shaped to support under the arm, where it's often quite painful post-surgery for women. And she also received a whole host of drainage tube holders that we have for shower use and also just for walking around, in addition to a protector for a car seat belt, because where the seat belt hits you is extremely sensitive and sore and can be for months post-mastectomy. So those are all things that are in our mastectomy kit. And then the quotes that you see come from Karen, who was in touch with her social worker immediately after receiving these gifts. And again, you can read them, but these are the kinds of thank yous and testimonials that we receive from women all the time. Can you scroll down, please? The two key objectives of our grant were to increase the number of New Jersey women who received our kits by 100, and to make sure that their rating of satisfaction with the kits was at least at a 90% level. Scroll down, please. So we're really proud. Within the first 6 months of the grant period, we've already distributed 124 to women, 124 New Jersey-based women. We've distributed kits. And so we've already completed that objective. Of course, we continue to send to any woman who needs, and many women, as you can imagine, and from the anecdote I just shared with you, receive multiple kits from us. And in terms of the satisfaction rating from the survey that we do together with Georgetown Lombardi, we've collated feedback that ranks satisfaction at 92%. So we're thrilled with that and hope that you are as well. We are on track in every way with the timeline and the budget, and we anticipate no changes. And really just want to share with you a couple more quotes about the impact of the work that we do. So many women are hesitant to reach out to Sharsheret because they feel that they have enough. And as women, we're so used to being the givers. It's very difficult to ask for and to take help or support from anyone. At Sharsheret, we consider it to be a privilege and an opportunity for us to represent the entire Jewish community as we make a cancer experience a little bit less awful and less lonely. And as we represent community, we're able to help women feel like they don't have to experience cancer and go through cancer alone. So it's a privilege for me to be able to be with you this evening on behalf of my colleagues who are unavailable on vacation, and to answer any questions that you might have about the kits, about Sharsheret, about the work that we do. But if there's one thing I can leave you with, it's this. Sometime in the near future, unfortunately, I'm quite confident you will come across someone in your life who needs Sharsheret. Please send them to us. Please connect us with them because we can help make things a little bit easier.
Thank you so much, Devorah, for being here tonight. If there's any questions, women will write them in the chat and we'll make sure to forward them on to you. I see a lot of clapping hands in the background, but thank you so much for that wonderful presentation.
Okay. Anything else, or I should just exit?
No, thank you so much.
Okay.
And
Thank
now,
you all. I wish you good health.
thank you. And now, before we go on to our next presentation, a few announcements. First of all, there is a membership brunch on February 4th for members and prospective members. So Corinne and Lizzie are hoping that you guys are going to each have a friend that you're going to bring to that membership brunch. And the time to reach out to that friend or family member who you want to invite is now, because we really would like to know our RSVP list by the beginning of next week. So please make sure to do that as soon as you can. Someone's not muted. Bucket meetings are beginning February 8th for our large grant process. Look out next week for signups with Sign Up Genius. And one more event that I want to highlight is tomorrow. If you have not responded but still want to come at 11 a.m. tomorrow at the home of Robin Widehorn, Orit Sulizano is speaking. She is the executive director of Association of Rape Crisis Centers in Israel, which is one of the 2 organizations that we funded with an Emergency Israel grant. If you would like to be there to hear her briefing, please email me or Rachel during or after this evening. Okay, and now we will go on with our next presentation from Girls Helping Girls, period. We have Elise Joy, the executive director, and Sandy Green, the program associate, who will be speaking about their project, Period, Equity, and Sustainability. Elise and Sandy, are you on?
Hi, yes.
Don't know why my video didn't start. Let me do that. Hello.
Welcome. We're happy to have you.
Hi, everybody.
Hello.
Okay, you've been introduced. You might have come on during the introduction, so you can go ahead and screen share and start whenever you're ready.
Okay, let me do that. I will get into. Just move this over. Why is it that the Zoom thing is always in the wrong place? Okay. All right, everybody hears me okay?
Yes.
Okay, good.
You're good.
Hi, everybody. I'm Elise Joy. I'm one of the co-founders of Girls Helping Girls Period and the executive director. Sandy works with us on education and outreach, and she's on the call as well. Just as a quick reminder, Girls Helping Girls Period started when my daughters and I, about 8 years ago, did a small project that eventually turned into a nonprofit, and I now run it as our professional executive director. We've donated close to about 4 million disposable menstrual products. We run workshops that teach about menstrual cups and basic menstrual management, as well as advocacy. And we do advocacy work on behalf of people who menstruate, most recently helping pass a law in New Jersey that will require that schools provide free period products in school bathrooms starting in the fall, which we're really, really excited about. The project that we are doing with you was Period Equity and Sustainability Project. What we have done in the past was we have done everything from give out menstrual cups to talk with people individually, but long story short, we don't think that any of it was ever successful because there's such a steep learning curve in using a menstrual cup, and we have found that people need, beyond just the initial education, they need some support to get through. There's lots of questions and everybody has their own individual questions. So we designed a program that we sort of piloted last year, but we are now doing the first year of doing it, where we offer about 45 minutes to an hour, sometimes they're a longer workshop, where we talk about how to use a menstrual cup, everything from how to insert it and take it out, how to sanitize it, clean it. We explain a lot about female anatomy that, and we're talking mostly to, almost exclusively actually, to college age women. And then beyond that, what we're really excited about in this particular program is that for the next 90 days, at the end of the program, if they decide that they want to opt into our program, we offer them a menstrual cup, and truth be told, we'll give them a menstrual cup regardless. They don't have to opt in. We have had 100% who have wanted the cup have agreed to shoot a QR code. They fill in a quick survey about whether they've ever used a cup before, what menstrual products they use, very basic information, and we record nothing but their cell phone number. And then for the next 90 days, every 2 weeks, we send something to them that reminds them of lots of different things, how to insert it, how to sanitize it, some frequently asked questions, and they are welcome to text back with us at any point, which I want to show you they do quite often, and sometimes at really inconvenient times, but we're here for it, and it's been great. What you see are some of the worksheets that go into our folder that we give out in our workshops. I know they're not really clear, and I'm happy to share whatever anybody wants to see. The first page is the one in the upper left. It explains just very briefly what our program is about. It says that yeah, go ahead.
We're not seeing that. We're still seeing the page that says interim report.
Oh, you're not seeing all the pages that I'm sliding through?
Nope, but it was okay. And I think now it's important for us to be seeing them.
Okay. So I don't know why you're not. Okay.
Go up to present in the top corner.
Yeah. It's in present mode and it's working as if in present mode. All right. Let me try one more time. Do you see the page?
I think you selected the wrong window to be shared.
I think it just started. It just started flipping.
Yeah, I only have that one thing open, believe it or not, Sandy, on my desktop. Are you seeing the picture of, here, let me just stop. Let me just share one more time. I'll stop and start one more time. I apologize. I'm going to share my whole desktop and you're going to maybe see the big mess that it is. Let me just present one more time. You see us there? Okay, thank you so much. Sorry about that. This was just a description of what I was talking about before, what's offered in each program. And my apologies, I must have hit the wrong window, which is weird. I've done this 8,000 times. So anyway, the next is, these are some of the worksheets that go into the packet that we give. Everybody gets many things, including the QR code you see there that helps them scan the first survey, which opts them into the 90 days of support. The first page has your logo so that everyone knows how we are able to bring this to them. We have a let's begin and a let's wrap up that's been really helpful to us. We give them 5 minutes at the beginning to write down any question they have, just sort of do a brain dump so that they make sure that we get to everybody's question. And then when they're done, we use this sort of as a survey to like, what did you learn? What would you want the next person to know? And they've been really helpful to us. We have created with an illustrator designs how to insert menstrual cup, how to remove a menstrual cup, how to sanitize it. There's lots of tips and tricks, Q&As, and then obviously some physiology. On this page, you'll see some of the responses. Over on the right was Karina is a group leader from Montclair State, who was just talking to us about the program that we did for them there. These are examples of the text. I'll just play this one. You'll see it scroll that go out about every 2 weeks. And I'll just stop so you can read. We get a lot of texts. I've gathered lots of these. We get lots of texts at when we send out these texts, but also at very random times. I would say probably 25% of all the students that we interact with regularly chat with me. And in some cases, they will get on the phone with us, mostly with Sandy, honestly, because she uses a menstrual cup regularly and is happy to share her experiences. So, I've very purposely not included photos of the people in the workshops because we've been very respectful of their anonymity. It's very hard to say that we're going to do this anonymous survey and only take a phone number, but then I'm snapping pictures. So we've taken some from behind, but you know what the backs of heads look like. That's what Sandy looks like when she's presenting, and we've done all the workshops together. Two of the things that we wanted to focus on were originally we had said we would engage with 200 people and we would have 100 opt-ins. I'm going to approach this sort of all at once. What we found pretty early on was that engaging a lot of people wasn't really helpful in getting people to buy into participating in any sort of study, but then necessarily feeling any kind of buy into learning how to use the product. We found that like we were running workshops and people would sign up and then wouldn't show up, or people would show up and they'd kind of like walk in and then wander out. It was sort of there was nothing invested for them. So instead we have changed our strategy, and Sandy is now focused, which has affected our budget a little bit, but worked out perfectly. Sandy is focused a little bit more in the past month or two on more outreach and more explanation up front, so that when people are invited to these workshops and we're working with a partner at a community college or at a local school, the students know before they come exactly what is going to happen, so that they're excited about learning. Oh, I get to go and learn how to use a cup, and you're going to give us a cup, as opposed to just learn about menstrual cups. And that strategy has been really helpful. I think, Sandy, you can correct me if I'm wrong. I think everybody who's shown up to a workshop since we changed the strategy has wanted a cup and has wanted to participate in the survey. Unfortunately, the numbers are still really low, but we're getting there.
Yeah, it's 100% opt-in. It has been 100% opt-in since we started doing much more targeted but smaller workshops.
Yeah, it's like we like to say, work smarter, not harder. So that's been great. We, for no reason other than we just felt like we would be better off on our own. When we originally had written the budget and presented it to you, we were working with a company based in California that had done a lot of research in Africa and done a lot of work to donate cups in Africa. And what we found in working with them, they were lovely, wonderful people. But what we found in working with them was that we just did not have any control over the data that in the way that we wanted to. For one, their survey had a ton of spelling errors that just made me crazy. I just don't like putting stuff out that doesn't look nice. And their data manager was in Africa. And I had to go through this company to get to their data manager. So if I wanted just to ask a question about somebody's response, it was a very long turnaround. Sandy's become a little bit of a whiz on a data program that we are using. And so we are collecting all of the surveys ourselves. It gives us a lot more flexibility to write the surveys the way we wanted. Money that we had anticipated that we would use for buying menstrual cups at this point, we have needed to use for outreach. And that's worked out just fine because that company gifted us they're still very happy and proud of the work that we were doing. And they said, keep the cups that we had given you. So that it was kind of almost an even exchange. So that's the difference. We've used much less on supplies. We have purchased menstrual cups because we've anticipated, we were supposed to be doing a specific workshop with the parents of students. So we knew that the majority of these people had given birth, and that was a different size cup than what we had in stock. One of our challenges, actually, let me just go back for 1 second. One of our biggest challenges has been completely out of our control. We've done a number of workshops in the last 2, which we're going to be probably engaging, we're guessing 30 to 40 people, were canceled because the woman who was in charge of them got into a car accident the day we were supposed to do the first one. They were 2 days in a row. Her injuries were more serious than she originally thought. And so both of them have had to be rescheduled. So
Please, 2 more minutes, please. Okay.
thank you. So that's really where we are. We have those have been rescheduled. We have another few in the works. So we're a little bit behind on where we wanted with actual participants in the study, but we've made some changes as a result of our changing how we were going about getting people to participate, and have found that that participation is much better than when we had first started, which is ultimately what we want. Whether people adopt the practice or not is not of concern. We want to learn what helps them along the way, and their responses are going to be helpful to us in that way. So with that, I will stop and welcome any questions.
Thanks, Elise. I don't think we have any questions at this time, but sometimes they come in afterwards. So we thank you so much for your presentation.
Absolutely.
People are clapping hands, but they've been asked to stay muted, so you'll have to see their reactions. Thank
No
you so much
problem.
for being with us.
Of course. Thank you.
Okay, our 4th interim report presentation for this evening is from Kindersmile. We have Dr. Michal Herman, who is the COO, and Nye, I believe it's Viel, but I might be pronouncing it incorrectly, who is the program director for the Perinatal Health and Wellness Program at Kindersmile in Bloomfield. Dr. Herman, are you with us? Rachel, have they been admitted?
Yes,
Okay. There you are.
we're here.
Great.
Thank you for having us.
Great. You're going to screen share yourself?
Nai's gonna screen share, actually.
Okay.
Can everyone see it okay?
We're good.
Perfect.
So first of all, thank you all very much for this grant and for giving us the opportunity to continue our perinatal health and wellness program this year after we had a break of a couple of years in funding. I'm Dr. Michal Herman, and I'm the COO of Kindersmile Foundation, and Nai will take it over when I get to the perinatal program. I'm going to give a brief overview of just Kindersmile for a minute, and then Nai will take it over from there. So Kindersmile Foundation is a nonprofit 501c3 organization that was founded in 2007 after the death of a 12-year-old boy from Maryland named Diamante Driver, who died from a tooth infection that traveled to the brain. Our mission is to provide oral health care and oral health education to children, and we envision a future where every child has access to a dentist and preventable dental diseases are eradicated. So in the past 16 years, we provided over $12 million of in-kind care and provided care to over 47,000 underserved patients to eliminate the #1 disease of underserved children, which is also preventable. And that's the sad part. And this is just an example. These are our actual patients right here in New Jersey. So among young children, the prevalence of untreated decay is much higher for Black and Hispanic children than for non-Hispanic white children. And you'll see on the next slide, our demographics is almost nearly half and half Black and Hispanic, and less than 7% of our patients are non-Hispanic white children or white children or adults. And over 93.5% of our patients are either insured by Medicaid or entirely uninsured. Our 3 dental homes are located in Bloomfield, Newark, and Trenton, New Jersey. Bloomfield, where this program is being supported, was our first dental home and was established in 2016 in order to give a dental home for the children that we've seen in the community. So from 2007 until 2016, we only had our oral health program where we go to schools and community centers and provide oral health education and dental care for children. And every year we saw that they came back with the same and more cavities with no other places to go. So that's when we decided to link them to a dental home was a crucial and important thing. And we promptly link everyone to a dental home as soon as we see them in the schools or in any of our other programs. And these are our main programs. So KSOHP is our KinderSmile Oral Health Program, which is what I just described, where we go to schools and community centers and provide oral health education and care and link them to our dental homes. Our CSLP, Community Service Learning Program, provides volunteer opportunities to students from high school to postgraduate school. And usually it's students that are either pre-dental or pre-public health and spend hours and hours and days with us volunteering and learning the inside and outsides of nonprofit organizations. Our Give Back a Smile program gives an opportunity to dentists and dental hygienists to volunteer their time to uninsured patients. And then, of course, our perinatal health and wellness program, and I can take it from here.
Hi, everyone. My name is Nai Beal. I'm the Perinatal Health and Wellness Program Director over at KinderSmile Foundation. So I'm working directly with the pregnant and postpartum moms up to 3 years, providing them with the education and ultimately linking them back to a dental home. But a general breakdown of what the program actually is that we are breaking the dangerous cycle of untreated dental disease in uninsured and recently Medicaid-insured moms from pregnancy and up to 3 years postpartum, and providing them with informative, culturally sensitive educational training about the importance of maternal oral health and its impact on overall health, in our case, more specifically, the developing fetus and young children. So essentially, all moms have to do is complete our oral health education curriculum. It's like a training course, and then mom and child are linked back to a dental home. Okay. So just some information about the PHWP team. I introduced myself a little bit, but I am directly working with the moms, community partners, and really making sure that we're uplifting PHWP to the community as well as our community partners and educating everyone on the importance of maternal oral health. I oversee both program locations in both Bloomfield and Trenton, and working closely with Dr. Herman and Dr. Nicole, who you guys have met before, just to make sure that we are actively accomplishing our goals for the program, which is to make sure that we're educating these moms, providing them with the dental care as well as their children. This is Shaila. She's our program assistant. She is a Latina woman herself, but she provides a lot of the Spanish educational training to the moms. And I like to say that because of her background, because she's a mom, she's able to kind of build trustful relationships built upon the concept of relatability. So it's a lot easier for our Spanish moms to comprehend, to receive, to understand the material when it's coming from someone that looks like them and has had similar experiences to them. So she serves kind of as a representative alongside of me, making sure that these moms are getting the education and the care that they need and know about the program. So why is this program needed? Ultimately, like Dr. Herman said, all of our community programs, whether it's our volunteer programs for pre-dental students, public health students, registered dental assistants, hygienists, whatever it is, we are addressing the social determinants of oral health care. So we are addressing the unique needs of at-risk and low-income children and families, and inclusive of families, obviously, are our moms. And knowing that there's a maternal health crisis happening all throughout the United States, not only in New Jersey, it's our job as the oral health care experts, I would say, to kind of lessen or find a solution to this problem through the provision of oral health education and care. And so to do this, we eliminate a lot of barriers that these uninsured, marginalized families typically face on a day-to-day basis. So that would be lack of coverage. Like we said, we're seeing moms who are uninsured, whether that's due to like documentation issues or private insurance is too expensive and they don't necessarily qualify for Medicaid. In that case, they still need dental care. We're able to kind of lessen the fees, almost providing free to low cost dental care for these moms. Convenient hours. All of our training sessions that we provide in the perinatal health and wellness program are tailored to mom schedules. So that can be in the morning, the afternoon, after work, on the weekends, whatever it is, we're making sure that there's no barrier to receiving this very, very important information and education. Fear, like I said, a lot of our moms are coming from other countries, those who are undocumented. So seeing someone like myself or someone like Shaila or someone who has taken the time to understand their background and where they're coming from makes it a lot easier for them to receive and comprehend the information that we have to share. Lack of childcare, I would say. We encourage moms to bring their children to sessions. So there's no reason why these moms shouldn't be able to get the education directly in our care. Immigration status we talked about, we're seeing all types of moms uninsured due to documentation issues, which is a huge portion of the population that we see, especially here in Bloomfield for our moms. Lack of transportation, trying to go quick, but all of our dental homes are located along public routes of transportation. So making sure that regardless of your situation or anything that you have going on, everyone has access to this program and education. So a little bit on the relationship between oral health and pregnancy. So I like to tell all of my community partners that I speak with is that maintenance of oral health is important during all stages of life, not just looking at it when you're pregnant, not just looking at it when you have pain, but maintaining a comprehensive routine visit to the dentist, just like you would going to the medical doctor. And so inevitably within pregnancy, hormones within your body become heightened, making moms especially more susceptible for development of dental caries or dental problems. In this case, we have seen that premature birth and low birth weight are linked to periodontal disease, which is an infection in your gums, which is preventable. And this is true for about 60 to 75% of moms. So it's important that we're giving these moms the education, linking them back to a dental home to kind of lessen these percentages or statistics that we've seen over the past couple of years. And especially within the state of New Jersey, one of our goals as a program is to recruit more Black moms into the program, knowing that Black mothers overall in New Jersey are facing much higher shares of complications during pregnancy than any other race. So really important that we're not only educating our Black moms or Spanish moms, but every mom across the board. So the topics that we cover within our curriculum, we work with the American Dental Association and we do a Healthy Smiles from the Start presentation as well as video and give different resources to moms and materials within their folder or packet. But ultimately, KinderSmile Foundation is covering the impact of maternal oral health on the developing fetus, changes in oral health during pregnancy, how to maintain and take care of your oral hygiene before, during, and after pregnancy, combating misconceptions. A lot of our moms come in thinking that, you know, I shouldn't even be going to the dentist when I'm pregnant at all. That is not factual. That's not true at all. We take different measures when you are pregnant. For example, giving you 2 lead aprons when you're taking x-rays, but there are different precautions that we take to make sure that getting dental care is entirely safe during your pregnancy. We go over the effects of early childhood caries, different inappropriate usage of baby bottles, sippy cups, thumb sucking, all of that stuff, breastfeeding and oral health, but ultimately just providing moms with basic information that they can implement within their households, not only for themselves, but for their children.
2 minutes, please.
Okay, I'm gonna slide through. This is some of the presentations that we go through, the demographics. So to date, we have seen 363 moms educated in the program. Majority are Spanish speaking. 50% of our moms come in with a high caries risk assessment, making them more susceptible to periodontal disease or any dental problems during their pregnancy. This year for Bloomfield, 38% have been English speaking, 62% have been Spanish speaking. 12 moms have been pregnant within our program and 20 recently postpartum within 3 years. And then 100% of our moms are coming from Essex County. We provide to date $10,000 and $600.74 of dental care due to JWF funding these moms who don't have insurance. And then again, you can see that the percentage of our caries risk assessment in our moms this year is super, super high. So if we had introduced education earlier, this could be significantly lower, but we'll reevaluate at their 6-month appointment. This is some of the outreach that I've done throughout the program, just as the Perinatal Health and Wellness Program Director. Successes of PHWP, ultimately making sure that moms are getting the education, they're prioritizing their oral health, creating statewide partnerships, and ultimately just being a support system for moms. And it wouldn't be possible without the Jewish Women's Foundation. So we're extremely grateful. The impact, I'm going to go to the next slide, but numbers really show our impact. But lately, just working directly with moms, I've been able to see them empowered, whether they're vocalizing it themselves. These are some of the quotes. I feel more educated and confident about my oral hygiene as well as my babies. This program has enlightened me more about oral health and the benefit of dental visits, but just some things for you guys to see that they are empowered, they are learning, and they're implementing these changes within their households. These are some of our moms. And then some program updates. I talked about me coming in as Perinatal Health and Wellness Director, recruiting more moms to the program, expanding our bandwidth so that we're reaching all moms, and just connecting with more community partners to uplift PHWP as a resource to the community overall and garnering support from different organizations. So some of the program progress updates, we're on track with the proposed project timeline. We encounter minor challenges, but we're able to kind of work around those barriers accordingly. A lot is due to funding and not having, as much funding as we would want to see the amount of moms that actually want to come into the program, but we're still providing education, following up with dental care, free to low cost dental care with you guys. And it's our goal to educate 75 moms. So we're almost halfway there. And our proposed budget, we are on track with that as well, but we do foresee a break just because of the limit in funding. We are a nonprofit organization, so all of the funding that we get is from grantors. And so that means that there's still a large percentage of our population, our perinatal community, that still needs dental care. However, we don't have the financial means to provide that, but there are other ways around that. We're still providing education and still linking them back to a dental home with different fee and payment plans. And ultimately, we are educating 75 moms. And like I said, we're almost halfway there, but it's been very, very amazing to be with these moms, to hear their testimonies, and to see how impactful we have been in their lives already, just doing the education and then even after when they get all of their dental work completed. But thank you so much for your support.
Thank you,
Sorry, that was
Melanie.
quick.
Thank you. Thank you.
Thank you so much. We really, really appreciate it.
As you can see from the chats, there's a lot of positive response to what you're doing. So we thank you so much for your work.